Hi, so I'm Dr. Alan Walker, and I'm here at the Nierman course because I want to get my duckies in a row. All right. Discovered Nierman as I retired from the Army about 2 years ago and decided to open up an independent dental practice, build it from scratch. And after spending my entire life essentially in the Army in the last 10 years, 15 years of that as a dentist in the Army, picked up a lot of things and a lot of skill sets and whatnot. But when I realized once I retired, in order to take things to the next level, I learned in the military to basically along these lines. I know this seems kind of corny to some, but it is about getting your duckies in a row. And we're going to come back to how Nierman has helped me do that by coming in not knowing anything. Particularly, I discovered Nierman through dental sleep medicine, but also after using the services, and I did actually try other services who had similar softwares, but after going through those and going to Nierman, then I immediately saw the difference and how they can help us do what we do better, improve our bottom line, increase our production, do it more efficiently. And honestly, it's easy and it's organized. It really is easy. And I'm not kidding about that, to get that in there. So education and support for you is kind of the acronym that they come up with, but it really is easy. So as a new dentist coming in, starting to practice from scratch, and like most people get into dental sleep medicine, I didn't know much about it, where to go to, and everything when you don't know it enough looks good, okay? So you can end up spending a lot of money, going a lot of different ways, but at some point you really got to try to focus in on what you do. Also, initially when I found Nierman, I was at the AADSM course up in Chicago, and that is where you see a lot of vendors, pretty much the top people in the industry, and you get to sample and meet and greet, and then probably for the first 2 or 3 or 4 courses, I didn't really pay attention to that like most vendors, because you see vendors everywhere. But then as I got more into the AEDSM and the courses, then I started to discover and ask more questions about these companies and what they do and then what they could do for us. So my biggest thing has always been building a team, but learning information and then trying to make it as efficient as possible. One thing as dentists I don't think we do is get in contact with our medical side and that whole aspect of billing and how to do that and the best way to go about doing that. Well, again, Nierman makes it easy to do that. They've pretty much laid everything out, and I'm not kidding about that. From beginning to end, it's as easy as A, B, C, 1, 2, 3. You can go all the way to letter Z if you want, or all the way to the highest number you can think of. But pretty much you go in order from beginning to end. And it's so thorough and comprehensive that the notes practically write themselves. I'm not kidding about that either. When you get in, all you have to do is make sure that you're doing your part as a dentist, okay, as a provider, even if you're in the sleep medicine realm, to capture the information and record it properly. And when you do that, then you go through the process and the forms that's already set up for you through Nierman, and then you can easily be able to file your claim. Oh, by the way, they do offer a claims filing service. So, and they tell you up front. A lot of people say, hey, just let us do it and we'll take care of that for you. So Nierman says, you know, you can do it, we can do it, we can both do it or whatever. So they give you the option to do that. The cost is very, very reasonable. Some of the things like we got into that as dentists we do, and I have a cone beam machine service like that. So we're learning more about how to actually capture those patients when they come in. We take a cone beam, because they also do full arch reconstructions and implants that can actually be billed through medical. So if you have specials or things running, you can actually let your clients know, you know, hey, this is not covered under dental, but guess what? Good news is it's covered under medical. So, and so we run it. You don't lose anything by doing that. And if anything, you should help to reassure a patient that you're not even using your dental benefits, okay, as I like to call them, because I don't know if there's such a thing as dental insurance, but it is a dental benefit. Either way, the client gets to retain more of that benefit for use of them. We also get to do what we want to do, as far as treat the patient and take care and evaluate things. And we don't have to worry about necessarily saying what's going to cost you even more just to find out what's going on. Okay, so those are just some of the things. The software itself is very easy to navigate. It's super easy. I like it because I can understand it and my assistants can understand it and use it. The learning curve is like that. They easily pick up on it. And then it's kind of cool because my wife, who's my business manager, also with the billing, she has her part, my assistant has their part, I have my part, but we can all look at each other's individual sections or parts or responsibilities, and then we can come online with those and get those things worked out. I know there's always a lot of questions about, you know, again, which software to use, which companies. The other great thing about Nierman, when you start taking Nierman courses, okay, And one reason I'm doing this, Nierman is not paying me for this or anything. Okay, this is all voluntary. Why? Because they're that good. Okay, and they have a commitment and they believe in what they do. Um, I happen to have met the founder, okay, and the president. It's a family-owned company they created, and just the backstory when you talk to Rose, okay, and John, it's just awesome. It's amazing to hear how she built the company, where she came from, and her background in dentistry, where she's come from, and what she's been able to do with the help of building a team and get to this point is pretty amazing. And if you're in dentistry, you're likely not just a clinician, you're a business owner. So those things are important. So we can all appreciate the value of what goes into all of these things. So again, when you're using Nierman for you, not just for you as a dental provider or sleep medicine provider, but also things when you get into the medical side as far as TMJ, oral facial pain, billing, implants, those things like that, full arch reconstructions, which is what I tell you, in addition to single implants and a host of other things. That list is very long. And like Rose says, there's a code for that, okay? There really is. Once you start to get into that world, you may realize that, hey, you already have probably 40% of your own office patients that exist in your own database, patient base, that you can actually utilize and may be able to, bill through medical for services. They can retain that dental benefit. You can do more on the evaluation side and things like that and get the results you want and do, honestly, much better evaluation and more thorough in the process on that. So Nierman really is a pretty awesome system, to say the least. As far as value, yeah, okay. I would even argue that, and don't change the prices though, Nierman, that it's undervalued for what you get, and it really is. It really is, because they have a host of things to offer you. One of the things I like too is, like we all do, when I call somebody, I hate having to get a number for a number for a number, and then a whole, and then an extension to go to a number. And this is after I call their original number. Then you got to go to an extension. Almost invariably, every time I call Nierman, I either get a live person who knows me. At least I feel like they know me, and they are concerned about my questions or issues. And whether it's me or someone from my office, they're willing to engage and answer our questions. And if we don't get a live person, then they get back to you with the answer. And to be honest, I usually get 3 or 4 responses from people engaged in it, which is great, because sometimes you don't get one response. But here I have with Nierman, I have emails where there's 3 or 4 people connected to that issue who have responded in a timely manner. They keep you updated on courses, just about everything and everything within this realm that you want to know. So again, the acronym EASY, it really is. And that's what you want. Who wants to have to think about this? When it comes to writing notes, I'm a dentist. Do I really want to write medical notes? No, I don't. Okay. Do I really know how to write medical notes? Yeah, because I use Nierman. I'm smart enough to know how to do that. And that's really all I need to know. They organize that for you. That process, and when you get into the notes, you actually get to see that it pretty much drives you to remember the sequence, and be honest, part of your evaluations, the things you want to cover with that. So there's my take on Nierman in a nutshell. There's so much more. I probably could go on much more and longer about the things that Nierman has to offer. And oh, by the way, I haven't even gotten probably into about 30% of the software. So it's just exciting to know the potential of what it can do for my practice, how it can help us, and how we will grow with Nierman on it. And essentially, when we get new folks, new staff, it's easy enough for them to come on board and to learn the system. It's not difficult to learn at all. It's really easy. And as I was saying before, the earlier thing about the courses, love the courses. The courses are connected. They have the top people in the industry who are teaching these courses. And it's interesting. You go to one course and you hear the names from people you went to, whether it's at Hinman or some of the other big courses, they're all connected. If you ask a few questions and dig a little deeper, you'll probably find something more about that. So thank you. That's the honest to gospel, John.